Hello, great people, and welcome to another episode of the Health Nuggets series. And today we are talking about infant colics. Infant colics are defined as episodes of frequent, prolonged, and intense crying in an otherwise healthy baby. This means that the baby is well fed, is well bathed, and you've done a diaper change. You've basically done everything humanly possible to make the baby comfortable, but they are crying excessively, and no amount of consoling seems to be helping. Well, we know that babies express themselves by crying, but if you notice a pattern in which the baby is crying for more than 3 hours a day, for more than 3 days in a week, and for more than 3 weeks, then this could point out that the baby is possibly having colics. Colics are known to begin at early stages of life, but they peak at around 6 weeks of life, and they significantly decline as the baby gets to 3 to 4 months of life. In the next episode, we shall be talking about features of colics. Today, we are talking about features of colics. When a baby is having colics, you realize that they are crying intensely. And this kind of a cry is more like screaming or an expression of pain, and they are crying for no apparent reason. Umefanya kila kitu, you've fed the baby, you've changed their diapers, you have cleaned them, you have done everything that you can to comfort them, but they are still crying. That can be frustrating, right? Another feature is that the episodes happen within a predictable time. You realize that ikifika saa fulani mtoto anaanza kulia, and in most cases this happens in the evenings. When a baby is having colics, you will also notice that their face becomes discolored. It may become flushed. Another feature is that the body becomes tense. Their legs may be stiffened or pulled up. They may have clenched feet. They may have arcing of the back. They may have a very tense abdomen. Well, guys, those are the features of colics. In the next episode, we shall look at the causes of colics. Hello, great people, and welcome to another episode of the Health Nuggets series. And today we are talking about the causes of infant colics. Well, the exact cause is unknown, but there are possible contributing factors that are attributed to the same. Number one, it is thought that the baby's digestive system may not be fully developed. Remember, colics happen anytime from birth. They peak at 6 weeks and decline significantly once the baby is 3 to 4 months old. So it is thought that their digestive system hasn't fully developed, hence the cause of the colics. Another reason is that there may be imbalance of the healthy bacteria within the digestive system, what we call the normal flora of the gut. Another reason could be overfeeding the baby or underfeeding the baby, or that the baby could be having certain food allergies or intolerance. The last factor that is thought to contribute to infant colics is the lack of burping the baby after feeding. In the next video, we shall be looking at the management of colics. Hey, great people, Health Nuggets series episode 4. Calming a colicky baby can be really a hard task. Soothing a crying baby is not easy. However, no matter how angry or how frustrated you are as a mother or the caregiver, please do not shake the baby. This can lead to a serious health condition known as the shaken baby syndrome, which can lead to brain damage or death. Instead, swaddle the baby in a warm and a soft blanket and gently rock them. If you're feeling so frustrated that you cannot handle the baby without shaking them, please seek for help. Let someone else handle the baby as you find some rest. Hello, great people. Health Nuggets series episode 5. Non-pharmacological ways of relieving the symptoms of colics. Once you're done breastfeeding your baby, It is advisable that you hold them in an upright position, preferably over your shoulder, and gently rub their back in a circular motion, what we call burping. This helps with releasing of any gas that may have been trapped within their gut during breastfeeding. If a baby is having colicky episodes, you can also place them across your laps on their tummy. This is known to help relieve the symptoms, and it's also a great way of enhancing neck control. You can as well massage their tummies to help release any gas. Hello, great people. Health Nugget Series Episode 6. There are so many drugs in the market right now for infant colics. However, before you administer such drugs to your baby, it is advisable that you consult your medical practitioner. Remember, not every crying baby has colics. Excessive crying in babies could be an indication of an underlying problem. So it is always prudent that you consult with your medical practitioner before you go and buy any drug to administer to your baby. Remember, infant colics can cause postpartum depression. So any moment that you feel you are out of touch with your emotions, kindly seek for help and look for someone to handle your baby while you find some rest.